guys, this is Virginia Keating. Welcome again to Aesthetic Minute, where we're going to talk about aesthetics, just a little brief discussion about aesthetics for a couple minutes. So today's topic is, last week we talked about the different neuromodulators. Today we're going to talk about where we commonly do Botox, Dysport, or Xeomin on the face. So the three most common areas that we treat with the neuromodular on the face is between the eyes, glabella complex, crow's feet, and the forehead. All three of those areas are really great places to treat with a neuromodulator, and that's where we really start seeing some of our lines being produced as we age. And again, remember, prevention is the key. So if we can get in front of the wrinkle, we're going to do a lot better than trying to treat a wrinkle that's already pretty deep in the skin. So the glabella complex, or the frown lines here, the muscle there brings our eyebrows in and down, causing this vertical line to form right in the middle between the eyes. And sometimes you might get two or just one, but the bottom line is these muscles pulling in, creasing the skin, causing that wrinkle. So it's a really great place to prevent and treat with a neuromodulator like Botox, Dysport, or Xeomin. Approximate dosing with Botox or Xeomin is around 20 units, Dysport around 60. We're all different. We all have different muscle sizes, so you're going to work with your practitioner to get the best dosing for that. But the nice thing about treating this area, again, because these muscles come in and down, when we treat that area, we're going to go in the opposite direction, which is up and out. So we get a little bit of a lifting effect, which is really great. And that's just really focused right here, right above the brows and on the top of the nose. Next muscle we're going to talk about is the forehead muscle. I got a little show and tell here. So you can see this purple area here is the forehead muscle. So it sits above the brows and goes up. And the thing that you want to understand about the forehead muscle is that its action is only to go up, to lift the brow. So the lines that form on the forehead are those horizontal lines that we get across there. But again, because its action is to go up, and I inject it, or your practitioner injects it with a neuromodulator, which is going to relax the muscle, what happens? It sits. So we have to be very conservative and thoughtful about when we inject the forehead muscle, because this is where we tend to get a droopy brow. Somebody who's accidentally gotten too close to the brow and hit the frontalis or the forehead muscle, or put too much up there where you can't really raise your brows. And personally and professionally, I think this is where we look done with Botox, when we overdo the forehead. We're never going to look done here, because unless you're an actor, you don't really need to have that frown. It's a pretty harsh look. We're never going to look done here because we got the cheeks coming up, and we're always going to have that coming up. But when you freeze the forehead completely and you can't raise your eyebrows, you can have a little bit of that Botox look. So we're always conservative on the forehead. So on that note, the amount of units really have a big range. With Botox and Xeomin, it can be anywhere from as little as 8 to 40 sometimes, if somebody had a really powerful, men who have really bigger muscles or a very powerful forehead that we're really trying to treat. With Dysport, it's going to be anywhere from, again, as low as 10, we're just hitting one spot, to 60, 70, and even 80 on the forehead, quite frankly, with the bigger muscles or a more powerful muscle. But the key thing you want to understand with that is that it is a sitting muscle. So we want to be very thoughtful on how we treat that, but we want to try to keep any lines becoming distracting or too deep on the forehead. The third area is the orbicularis. This is a round muscle around the eyes, and it contracts like this. So if you squint, you can see these fine lines that get brought on from that action. And so because it contracts down like this, when we inject this area, again, it's contracting down. So what's going to happen when we relax it? It's going to lift. So we get a bit of an opening to the lateral aspect of the eye, which is really nice. And we can even inject right under the brow or close to the brow at the tip of the orbicularis, which will help kind of raise that brow up. And that's where you hear about the brow lift. And so we can create a little bit of a brow lift with that. So that's another great place to go. And again, dosing in there is somewhat varied, anywhere from 10 to 12, 16 with Botox or Xeomin, to 20 to 35, 40 with Dysport. So those are some of the great places, the three most common areas that we treat with a neuromodulator. We do it all over the face, the masseters, the chins, the DAOs above the lips, and a lot of those places, which we'll touch on in our next episode of Aesthetic Minute. So please like it, subscribe to our channel, and stay tuned for the next episode. Thank you.